afternoon, everyone, and welcome to the Melanoma Research Foundation Meet the Honoree. We are very excited today to be having a conversation with Dr. Pedram Gerami from Northwestern, a very accomplished physician who we will be honoring at this year's 6th annual Chicago Gala. We'd like to say a big thank you to our sponsors, Genentech, Castle, and Neutrogena for their support, and let you all know a little bit about the event that's coming up this November. So for those of you who know, especially in the Chicago area, this is an event not to be missed. It is a wonderful evening where we all get together and honor some amazing physicians in the Chicago area, brave melanoma warriors who share their story and inspire others, and leaders in the corporate community who are doing more and more in the areas of prevention and education. So this year, because of COVID, as everybody knows, we are going virtual. But that doesn't mean you don't have to participate. If anything, it'll be a wonderful evening, a fun evening, a celebration that we can all do safely from our homes. So this November 5th at 7 p.m. Central Time, we will be kicking off our 6th annual Chicago Gala. Tickets are $150, and with your ticket, you get a gift card to either Maya del Sol or La Briola, two amazing restaurants that have supported the gala year after year. So for those of you who've attended in the past, you've definitely sampled their cuisine before. We will have a chance to win a trip, so you can purchase your chance tickets, as well as amazing auction items. So this is something that you don't want to miss. You can visit the website at melanoma.org/Chicago Gala to purchase your tickets and your sponsorship. But without further ado, I want to get started on our conversation today with Dr. Gerami. So for those of you in the Chicago area, you probably know him very well. He was voted Best Doctor in 2019-2020. He is the director of the Skin Cancer Institute at Northwestern Medical Group and the director of the melanoma program in the Skin Cancer Institute and the melanoma clinic in the Department of Dermatology. He is a wonderful physician who was nominated for this year's Humanitarian Award, and we are so thrilled to have him with us this afternoon to learn a little bit more about his specialty and, again, what makes him so amazing. So Dr. Gerami, welcome, and let's chat a little bit. Tell us a little bit about what you do at Northwestern and maybe a little bit more about your specialty in particular.
Thank you, Kylie, and thank you to the entire MRF organization for having me here today. It's really a pleasure. So I'm a dermatologist and dermatopathologist. So I take care of melanoma patients, and I also spend a lot of time reading biopsies of moles and other skin lesions that any dermatologists in our community or nationally have biopsied, and report on those. And I'm also involved in a lot of melanoma research. So taking care of clinical patients, the pathology, and melanoma research. Those are all things that I do on a daily basis, yeah.
That's wonderful. So tell us a little bit, for people who don't know, as a dermatopathologist, as someone who sees many moles, many spots each and every day, what is your biggest concern for your patients? What is that one thing that kind of keeps you up at night and you think, gosh, I wish I could, tell them this, or if people only knew that, is there something in particular?
That's a great question. One of the things about melanoma is that early intervention is just so critical. When we catch lesions early, we cure patients, and it's very exciting that we now have a lot of newer therapies for advanced disease too. That's really exciting. But as a dermatologist, I'm more on the front end, and I've always thought it's just so important that we get people in for skin checks, and not just once, because you can have a normal skin check, but then a little bit, months later, you might develop a new atypical lesion just a couple months later. So it has to be regularly done. And from the patients that we take care of regularly, we really have great results, and patients, we identify lesions early. So I think if I had a message that I'd want to get out to more people is just we need to get everybody, especially those people who are at higher risk, who have family histories, in for regular checkups. And I think we have an unbelievable opportunity to intervene early then and save lives.
Absolutely. Early detection is so key. And when you mention high risk, you mentioned family history, but a lot of people say, well, I don't have any skin cancer in my family. Do I really need to be seen? That's like people also saying, do I need to go to the eye doctor? I can see just fine.
Sure.
So,
yeah. Well, melanoma has really increased quite dramatically in its incidence in the U.S. over the last 10 to 20 years. Right now, it's about 1 in 40 Caucasian individuals. So it's pretty common condition. And like I said, it's a condition that if it's caught early, it saves lives. So I think, people should I think all Caucasian people should get at least a baseline, and then they can be assessed from there. And everyone should probably get a baseline and just get assessed what their baseline risk is. And the dermatologist, once they see them, can tell them, yeah, you have, basically a lot of sun damage, or you don't, and, we need to get you in this frequently. They can basically assess what their overall risk assessed level is and kind of guide them. But everyone should probably get that baseline assessment to know, to kind of get an idea how frequently they should come in.
Absolutely. And are there certain characteristics, again, that people should look out for? I mean, you said basically anyone who's Caucasian should get that baseline, but we've also heard of, fair skin, fair eyes, or maybe blistering sunburns, anything that people may have experienced in their lifetime that you think, oh gosh, you might not be super fair, but you've had X, Y, Z.
Well, the other risk factors that are strongly linked are a history, a lot of ultraviolet exposure, like if they've had more than 5 blistering sunburns, or tanning bed exposure, obviously, even 10 lifetime tanning bed exposure. Now, most people, if you ask them, have you used tanning beds? And if they used it about 10 times in their life, they would say, no, I don't really use tanning bed. But even just having had 10 lifetime exposures to tanning beds gives you about a 30% lifetime risk of melanoma. So any history of tanning bed use, and of course, other forms of UV, just being out in the sun. I always think it's kind of funny when I'm talking to my patients and I say, well, how are we doing with our sun protective measures? And they say to me, well, I've been doing really good. The only time I've been out in the sun is while I've been gardening and stuff. And I'm like, well, the sun doesn't really care what you're doing out there. It doesn't turn off because you're gardening right now, so any type of UV exposure, really. Yeah.
And we know in Chicago, because it's so cold, that as soon as you all start to have that nice warm weather, everybody flocks outside and tries to soak up time on the lake and really enjoy that outside sun. So I think it's very important too, where you live in the country, because you're inside so much. Let's talk a little bit about COVID. I mean, I feel like it's what everybody wants to know about, but I know for the Melanoma Research Foundation, we've seen a lot of people say, gosh, I don't necessarily know if I want to go see my doctor right now. It's not urgent or it's not an emergency.
Yeah.
As a physician, what are you seeing, and what kind of message would you give to people if they're putting off appointments right now?
Yeah. Well, I think, number one, I think our institution at Northwestern has done a really amazing job of creating a safe environment to take care of patients. And my messaging during this time has really been to tell my patients that, again, we really want to emphasize the importance of early intervention. I think there are ways to take care of patients safely right now. Everybody masks up. the physician should be wearing a mask, the patient wears a mask, and you screen appropriately. Obviously, you don't want to come in while you've just been diagnosed with COVID like last week, but once you kind of screen through like not having any high risk symptoms at that moment, and everyone's appropriately masked up and so forth, I've really been emphasizing my patients that we don't want to delay intervention. We don't want to have a situation where we let one of these atypical lesions get ahead of us and miss out on a chance for a cure. So so that's really been my messaging, to let patients know that we do have a safe way of taking care of them at this time, and we don't want them to delay their care because it's really critical,
Absolutely. And are you starting to see more patients coming back? Are you starting to see things kind of resume back to normal? Are people feeling comfortable again?
Absolutely. And I think a lot of people, I have some patients, like my highest risk patients, who are on a 3 to 4 month schedule of return visits. And I noticed like the first time they come back, that's when they're kind of the most anxious about it, or a little bit the most concerned. And once they get in and see, okay, yeah, they've got a way to do this safely, and it's really, everything's kosher and good. Then by the second visit, it's kind of all water under the bridge and people. So we're actually really busy right now, and pretty much I think the volumes are as high as they've ever been. I think people are feeling more and more comfortable now, which I'm really happy about.
Yeah, that is so important. So important that people are getting their skin checked, and so important that they're going back to see their doctors. So good. Well, let's talk a little bit about the gala. You will be receiving the Humanitarian Award this November. You were recognized by the Gala host committee for the incredible work you do on behalf of melanoma patients and early detection, and certainly the research that you're doing as well to really advance the field. Let's just talk a little bit about what this award means to you, and as a physician, what inspires you to get?
Thanks. So obviously the award means a great deal, and I'm very thankful to the MRF for this. It's just really great to have an opportunity to kind of take a moment out and share a moment with the patients, the people that you take care of, and really have a chance to really thank them, because the relationship that you kind of get to have with melanoma patients, it's like a really unique relationship, I think. One thing I really noticed early on in taking care of melanoma patients is these are such courageous and brave people, and so many of them have undergone and been through so much. So they inspire me, working with them and working with people that have had so many hiccups and heaviness in their life, and managed to keep a smile and managed to stay strong and have such a great attitude still. I find that inspirational, and I often will go home and just share a story with my kids when I see them having a bad day, or my wife, and just tell them about this amazing patient I had, and just how inspirational they were. So to share a moment with them and thank them, that's what it means to me, and that's what I really think is the greatest thing about this opportunity. And the other thing that really inspires me is the opportunity kind of to do something on the other end, and maybe do something that affects them. Melanoma patients, one thing I think that's unique about them too is that there is a certain anxiety that comes with melanoma that I think is different than other cancers. And I think it might be related to the fact that it's something visual that you can see on your skin. And, if let's say you had colon cancer, it might be, not to dismiss or underplay the significance of any of these other cancers, but sometimes with the cancer like that, I think it might be a little easier at times to disconnect from it. it's inside of you. You're not observing it. You don't see it in the mirror when you get up. But melanoma is different in that sense, that people fixate on their skin and then they get obsessed with every mole and every lesion. And so there is a very specific anxiety that comes along with it. And if I can play a role in connecting with people and kind of helping them with their fight, and the fact that they trust me or give me that trust, I mean, that's a big thing for me. And so if I can do something there, that inspires me too. So those two aspects of the relationship that I get with my patients, it's a big thing. And I'm thankful to share a moment with them, really. That's what I'm really thankful for. You know?
Well, you can definitely see your compassion coming through, Dr. Gerami. And I would say that, you know, that's not something that all physicians have, and you certainly have it in spades. And that's one of the reasons why you were nominated to receive this award. Maybe we could talk a little bit too about a song that I heard that you did for COVID that you wrote. Would you mind telling us a little?
Oh, sure. Yeah. So it was early on in the pandemic, around March. I actually had a potential COVID exposure to one of my patients, and so I got quarantined. So I was sent home, and I was like, it was kind of unexpected. We just kind of found out after the clinic visit that the patient had developed COVID, and so they told me I had to go home. So I went home, and I had a little bit more time than typical, and I was messing around with my guitar a little bit. I talked to some colleagues at work, and I just realized, just like the whole morale and the mood of the whole hospital and friends and colleagues in medicine and everywhere, everyone was so down about COVID and just how it was affecting everybody. And I was just kind of fiddling with the guitar at home, and I said, I just want to write this little kind of comedic song, maybe just as a pick-me-up for people. And so I put together this song. I put it on the background of Eric Clapton's Layla, and I just changed the lyrics around, and then I just posted it on YouTube, and a lot of people just got in touch with me, and I think it was mission accomplished, because people were like, yeah, I was having a horrible day, and I saw this, and it just made me smile. And so I think it accomplished its mission.
That's awesome. Levity, right? We all need more levity.
Yeah.
That's fantastic. So anything else you want to share? And again, if people have comments or questions, we will be answering them after via our Facebook comments section. But anything else that you think our community should know, or people should know in general, about either getting their skin checked, or melanoma, or dermatology in general, getting treated during COVID, anything that you want to share with them?
Sure. Again, I do want to thank the patients. I think, at the bottom, it's all about them, and knowing that I could do something to make their lives better. I'm just thankful for that, and I really want to thank all the patients for entrusting me with their care. One thing I'm excited to tell people about Northwestern, at Northwestern, we're very dedicated to the fight against melanoma and our Skin Cancer Institute. And recently we acquired some new technology, something called IntelliStudio, which is a really nice system that does digital full body photography. And it has very advanced AI and software that basically, if you did these total body photography pictures of a patient from two different time points, you could have it analyze the images from two different time points and then say, please sort for me the lesions in order of which has changed the most in color or which have changed the most in size. So it's not a diagnosing system, but it does help us track lesions and tell us about changing lesions. And this is just kind of like the newest thing that we've brought on board to help us with our fight against melanoma. And I think it's a good thing for people to know about, and I'm excited to share that with
That is
everybody.
very cool. I mean, for, dermatology is such a visual science, and to be able to use artificial intelligence like that is really
Yeah,
awesome.
we're so excited about it.
That's great. Well, thank you, Dr. Gerami. We are so excited to have this chat with you today. We're even more excited to honor you in November at the 6th Annual Chicago Gala. We hope you all will purchase your tickets. We hope you will join us virtually. Again, we're sad we're not celebrating in person, but we are still excited to celebrate in general and raise funds for the melanoma community. What we say here at the MRF is cancer has no curve. We must continue the fight. We must support the patients and the families that are impacted by melanoma, and we must raise funds for research to help lead us closer to a cure. So again, please go to our website, melanoma.org/Chicago Gala to find out more. And again, we'll be hearing from Dr. Gerami again in November. So thank you again for joining us today. And we're excited to honor and recognize all that you have achieved.
Thank you, and thank the MRF for all the work they do. It's very passionate work, and we're grateful to them.
Thank you, Dr. Gerami.